Hello everyone, today we will be discussing cannabis use disorder. Cannabis is known by other names such as weed, marijuana, chiba, flower. Marijuana is smoked through vaporizing, smoking in a joint, a water pipe such as a bong, or eaten. General description of cannabis use disorder diagnosed by the DSM-5 criteria is cannabis use that causes significant clinical impairment or distress. The symptoms of cannabis use disorder must persist for 12 months or be two of the following symptoms on the next page. The symptom that stands out to me is if you are not partaking in recreational activities anymore due to being high or in withdrawal symptoms. And withdrawal symptoms are you are having a irritability or lack of sleep, and also marijuana also exasperates any mental disorders, underlying mental disorders, or any genetically predispositions for psychotic disorders such as schizophrenia and mood disorders like bipolar disorder or depression. The DSM-5 considers cannabis use disorder mild if you do 2 to 3 of the symptoms. It is moderate if you do 3 to 4 symptoms, and it is considered severe if you do 6 or more of the symptoms. Rates between 18 and 24 years old are 26%. The prevalence rates decline as the age decreases.
Start.
The prevalence from age range 35 to 44 decreases to 19%. From ages 45 to 64, it drops down to 11%. All of this data is within a 12-month period. Differential diagnosis for cannabis use disorder can be confused with general anxiety disorder, persistent depressive disorder, or schizophrenia, or bipolar type 1 and type 2. Other substances can be confused for marijuana intoxication or cannabis use disorder, such as alcoholism, opioid use disorder, or stimulant use disorder.
Start.
Clinicians should be sure to test urine to rule out any other substances when diagnosing cannabis use disorder. The National Institute of Drug Abuse, through the National Institute of Health.gov, reports that cannabis use disorder is treated through CBT, cognitive behavioral therapy, and MET, motivational enhancement therapy. There are no known pharmaceutical treatment for CUD, cannabis use disorder, but there is pharmacological treatments for withdrawal symptoms such as problems having with sleep or irritability. Cannabis use disorder can bring up pre-existing mental disorders and exacerbate pre-existing mental disorders. It is very important not to partake in heavy cannabis use, as an adolescent because it does higher the chances to develop schizophrenia.
Start.
Due to the risk factors of heavy cannabis use, there is an important it is important to recognize the increased use and risk factors of heavy marijuana use. It has been my pleasure in telling you about the facts of cannabis use disorder. And please watch your smoking and have a great day. Thank you very much.